families after the patient, like ye khana khaye, na khaye, the blood sugar badhegi, ye na khaye. I must tell that yes, diabetes had a lot of relation to diet and the lifestyle. And if you're eating the normal balanced diet, there is nothing really much you can do to control your blood sugar except trying to have weight reduction. So the main issue should be on overweight rather than trying to get into what exactly is in the morning and what is exactly evening. Now, the concept I keep telling my patients that what you call it, khet to plate theory, what I call it, jo khana, whatever is grown on the earth comes to the plate without being processed is good for us. Anything what is grown on the earth, which includes fruits, vegetables, grapes, chikus, bananas, brinjals, anything what is grown on the earth, be it wheat or jowar ki atta, anything. The problem what happens that once we have interventions from the processing side, for example, a maida stuff, which includes be a gulab jamun or be it a pizza or be it any naan made of maida or even simple biscuits can cause much harmful than a natural product. So do not hesitate to eat natural fruits and fibers. It's part of the balanced diet. There's nothing called diabetes diet. What a 10 years old kid should be eating, a 70-year-old gentleman granddad should be eating the same. There should not be a difference in that, because the standard, especially any food across the country, will have a carbohydrate, should have a protein, should have high fibrous diet. And what I call it, 5 fruits fiber a day means 2-3 sabjiyan and 1-2 fruits. Fruits are good for us. They have high fibers, they have natural fructose, and their glycemic index is not higher than compared to a packed and processed food. I also tell my patients anything which is packed and processed in a box usually not good and should be avoided. Be it a laddu, be it a cornflakes, be it a biscuit, because they're processed, the fiber is thrown out. You can have fruits and you should have fruits. It's not about if can have it, because once you have diabetes, you are allowed to have any other disease. You're prone to have any illnesses, including cancers. So once you stop eating fruits, you're protecting from natural sources of antioxidants. So diet should remain whatever, even if you have diagnosed diabetes. The more is, if you're overweight, the calorie restrictions needs to be there. And more than that, I think we Indians don't exercise enough, we don't walk enough, and we must walk. Yes, yogasana, pranayam, yogasana are important, but you must walk, and that's the most important mastery. Eat healthy, eat natural, eat what is grown on the earth comes to the plate. You should not think too much about it. Yes, you can have sometimes any sweets, any chocolates. You can enjoy your sons or grandsons' birthdays on a cake. It's not that you can never have it. So make sure you eat, as long as you eat majority of the time healthy diet, you're allowed to eat any sweets as well, like anybody else. So people with diabetes should not be discriminated about their diet, that they can't eat this, they can't eat that, and that becomes a bit of a problem, and that creates more or says, they make people depressed about their life, because they have been told on a daily basis on a dining table, look what you can't eat this, you can't eat that. So just eat normal natural fruits, and we Indians are privileged that most of us do the cooked meal right from breakfast, lunch and dinner, and we can eat the roti, sabji, dal, very standard food. Even like a thing like even so-called brown bread have a lot of maida-based products. They can bring the sugar much higher than a natural fruit called banana. So just be natural food and eat normally, and rather than restrict your life thinking too much on the diet, because a diet restriction would help to an extent somebody who has got long-standing diabetes. Even if you stop eating everything, your blood sugar would remain high, because you do produce glucose from the liver, what you call as hepatic glucose output. So yes, diet would help, but a lot of people would need more exercise, some would need medications, and some would require insulin.